The coronavirus pandemic has had an unforeseen impact on lives across the globe. As the world prepares for a post-COVID-19 era, discussions are already underway to understand the extent of impact and to support government to fashion out policies that would cushion the citizenry going forward. St. Ghana has been holding a series of such engagements across the country. My colleague Justice Bedu was in one of them here in Accra and has filed this report.
There hasn't been any intervention for the youth or any intervention for adolescents, and it's very alarming because
a young woman telling her story, a story of how a monstrous pandemic rocked her life and that of many people like her.
We've recorded increase in teenage pregnancy, increase in school dropouts. We've recorded increase in educational barriers, where most of our young girls and our young guys have stopped going to school because of economic hardships. We've realized that those in the rural areas are being left behind. Maybe a civil society organization or an NGO.
Lovia Tete runs a civil society organization in Accra and has seen and heard from many young men and women she works with every day about the toll COVID-19 has brought to them. This meeting has been called by Rights Campaign Group St. Ghana, giving a platform to people from all walks of life to come share their COVID-19 impact stories. Some of the people gathered here are representing the country's most vulnerable, like the severely ill and the aged.
During the COVID, there was no support from family and also philanthropy, simply because during COVID time, a lot of works have been shut down, and also family that have been helping people with disability, they find it very difficult also to get money from their workplaces. So it's very difficult for we persons living with disability to get support in terms of our daily activities.
They are those targeted by some of the country's social intervention programs like the Livelihood Empowerment Against Poverty program and the National Health Insurance Scheme. And as lockdowns and shutdown of businesses held back operations of some of these agencies that run these programs, they too felt the pinch.
Our social service department to even help us in a lot of ways, but for a lot of assessment that some of us or research that some of us have done so far, we foresee that there was no support from any of the social welfare department, simply because some of items that were even brought to be given to persons with disability is very difficult for we to assess it, and a few that were able to assess itself, by the time the items got to them, in terms of cooking items, some of the food is already getting to spoil before the food will get to them.
We are very much interested in people who are receiving existing social protection interventions, those who have the potential to receive it, and those who are managing it, to get a sense of how things have been since we had the pandemic here. In other words, how do we know that existing social protection programs are responding to the needs of its beneficiaries given the context of COVID-19?
This is only one of several engagements that are underway to better understand what this virus is leaving in its wake and to better support government as the world prepares for life beyond COVID-19. Justice Bedu, Joynews.